for use with cervical specimens collected using either a broom-like device or an endocervical brush and plastic spatula combination. The broom-like device is designed to collect ectocervical and endocervical cells from the cervix. Obtain an adequate sample by inserting the central bristles of the broom into the endocervical canal, deep enough to allow the shorter bristles to fully contact the ectocervix. Push gently and rotate the broom 5 times in one direction. Now rinse the sample off the broom in the Preservzit solution vial by pushing the broom against the bottom of the vial 10 times, forcing the bristles to bend apart. As a final step, swirl the brush between the thumb and forefinger vigorously to further release cervical material. Once rinsed, the broom may be discarded. When using the endocervical brush and plastic spatula combination, the plastic spatula is used to sample the ectocervix, and the endocervical brush is used to sample the endocervix. First, obtain an adequate sample from the ectocervix using a plastic spatula. Then rinse the spatula in the Preservzit solution vial by swirling the spatula vigorously in the vial. Once rinsed, the spatula may be discarded. Next, obtain a sample from the endocervix by inserting the endocervical brush into the cervix until only the bottommost bristles are exposed. Slowly rotate the brush 1/4 to 1/2 turn in one direction to minimize bleeding. It is very important not to over-rotate the brush. Rinse the brush in the same Preservzit vial used for the spatula. Press the bristles of the brush against the wall of the Preservzit solution vial while stirring the solution 10 times. Then swirl the brush vigorously to further release cervical material. Once rinsed, the brush may be discarded. Cap the Preservzit solution vial. Make sure to tighten the cap until the black torque line on the cap passes the black torque line on the vial. Record the patient's name and identification number on the Preservzit solution vial. Record the patient information and medical history on the standard cytology requisition form used by your laboratory.